right, now let's get down and dirty with the DVT. Oh, you know what, let's get this out of the way because it's also a risk for DVT. It's real easy. Go to the amputated patient. It's in there somewhere. Probably before the hip fracture, but I don't know. I don't even know. We can knock this out. Y'all tell me where you find them. Is it at the beginning or the end?
It's right after.
Oh, it's immediately after hip fracture?
Yeah.
Perfect. Okay, so after hip fracture is your amputation patient. Now, this is going to be good because after that we'll do the big one, the DVT stuff. That's a lot harder than this. So if you look at this amputation patient, you got a lot going on. And let me just say, I got rules. You're going to write the rules right at the top of that sheet. When it comes to rules with the amputation patient, you have to remember that day one, they're going to come out of the operating room with their limb elevated and in supine position. They're going to be in supine position, so they're going to be on their back, and the limb will be elevated. Who is the #1 person that gets amputations? Diabetics. Lift, keep the patient supine. That's on day one. First 24 hours, day one. You are trying to enhance venous return. You are trying to enhance venous return. You are trying to decrease the edema. You are trying to decrease the pain. So if you look on the left side of this page, you'll see it says just that. Now you need to put this. Days 2, 3, 4, prone, no semi-Fowler's position. Days 2, 3, and 4, your patient is prone, no semi-Fowler's position. So here's what we're trying to avoid. I've had that patient. I've had that patient with an above the knee amputation and they had a contracture. Contractures they cannot come out, they cannot be repaired, they cannot be fixed. They're stuck like this. That's a contracture. Why did they happen? Because these nurses did not know what they were doing. And so your patient, in order to prevent a contracture, and this is not just it's forever, they need to make sure they spend quite a bit of time laying prone, because it's only when your body is prone that you have full extension of this limb. And all of this is a straight line. So it's only when you're prone on your tummy that this is a straight line, and it has to be to prevent this contracture. When they are like this all the time on their back or whatever, then you get this contracture, and it is not going to be something we can reverse. And it causes incredible pain. So prevention of contractures in anyone, including your burn patient, is full extension of the limb. In this case, full extension of the limb. Gotta know that. Because she don't know that. No float nurse. Phantom pain is real. It's not in her mind. It's real. And here's why. When you look at your textbook, you think about it. You look at your textbook. Red arteries, the blue veins, you've got the little lymph nodes and little circles, you've got nerves, and they look like hairs branching out everywhere, don't they? Okay, well when you amputate, when they amputated the limb, the nerve that innervated that leg is still here. is still having pain and sending messages to your brain that this hurts like hell. This is severe pain. Phantom pain is real. It may require initially narcotics, and then we use something different. We don't want to keep anybody on narcotics, but that first day or two might be narcotics because it's severe. So we then switch them more so to nerve pain pills, right? Gabapentin, Tegretol, you know, the meds that were at Saturday class, right? So gabapentin, they may have a baclofen pump, Tegretol, Lyrica, and then we use something creative called mirror therapy. Raise your hand if you ever heard of mirror therapy. Has anybody ever heard of mirror therapy? If you work at the VA, they do it. So they put a mirror down there by your leg to remind your brain it's no longer there. It works. So phantom pain is pain in the limb that's no longer there. You put a mirror there, you're constantly reminding your brain it's not there. And it works. Now, to minimize phantom pain, you need to encourage that patient to use their prosthesis. Some people are afraid because training someone to use a prosthesis is incredibly painful. So they don't want any parts of it. But reality is, the more they use a prosthesis, the less they'll have phantom pain. And it's not just with amputation. My mama had phantom pain in the breast that was no longer there. Whatever we take from you, whatever body part we remove, phantom pain. Okay? Your brain's still working on the fact that the nerves are still there. Okay? So this is a big one. Now, put on the, if you look at here, look at the actual handout. You are wrapping this limb, and you will be. You need to use, let me see if I see it anywhere. I don't see it anywhere. Use a figure 8 dressing approach. It's called a figure 8. It looks like the infinity sign, right? I have one of those on my bracelets. So it's like a figure 8. Okay? Figure 8. Okay? So if I start, peep this, y'all. Let's say I got my ace bandage on the nurse. I'm about to do this. I'm going to start the, let me show you what this thing here. I'm going to start my ace wrap right here. And I'm going to take this and go like this. And then I'm going to go like this. And I'm going to be doing a figure 8. So I'm going to go just back and forth. Not like this. Most importantly, I am starting my figure 8 midway through the limb. I put that ace bandage or whatever you want to call it. Oh, wrong side. I put the ace wrap midway through, and then I go around the limb. Just like that. Not like this. Okay? Kind of important. When I'm finished with the wrap, where do I secure it? Where would I secure this? To my wrist. So when I'm done, I take my one edge and I attach it up here somewhere. Now down here, it's got to come all the way. So when I'm done, I take that last little bit and I secure that bad boy up here, or even wrap the last wrapping part of it around my waist and just go ahead and attach it. Know it. Okay, I finish it on the waist. I secure it, I anchor it on the waist. Okay. Now, if you look, this dressing is a pressure dressing, 48 hours. This is a pressure dressing, 48 hours. So, big deal things you gotta know. It says wash, rinse, dry, blah, blah, blah. Do not, put a star by it. Do not apply anything to residual limb. No alcohol, no lotion, no oils, no creams. Keep it dry. Encourage that patient to wear the prosthesis. All of that is there already. Initially, this is super, super, super painful. But wearing the prosthesis will decrease their phantom pain or their swelling. Okay? Last but never least, DVT, PE, frostbite, blah, blah, blah. We're gonna do traumatic amputee. I'm gonna write it down. You can write it on your, you got a couple of DVT things. First, go to the picture with the PE on it, and then we'll go to the words that I showed you. Go to the one where the picture is there. It's got a picture of a lung or something, a heart, a foot, and then the other one has a picture of the man. You're gonna love these handouts. They are hugely important, okay? So on the one that says the pulmonary emboli highway, I want you to write traumatic amputee at the bottom, and this is what it's gonna look like. Traumatic amputee and this is real quick and easy. So the way it works, we always have to fast forward, give your little ass some hope. Fast forward 4 years, you are a nurse already. You are minding your business, sipping tequila on your deck. Maybe you're a female, kind of loose around you. The sun is shining, you're feeling good about yourself. You're daydreaming, you done did 3 12s in a row. So you got plans, you got big plans. You slept through one of them, but you got some more left over. So now you're thinking about how things are gonna go. You got a hot date, okay? You got your little shit together, your nails and stuff is done, you're cute. Now, you are on your 4 12-hour shift stretch. You are daydreaming about your date. You are in the midst of your own karma. You are having a good life. All your bills is paid, student loans coming down, you're feeling good. Now here's what happens. In the middle of your daydreaming, you hear this piercing scream. You're like, oh hell no. What in the hell? And it dawned that that sound was suspiciously similar to your neighbor's voice. So you jump up, you tie your halter top back on, and you go over to the neighbor to see what the hell is going on. When you get over to your neighbor, this fool was cutting his grass in flip-flops. Yeah, and he hit a rock. Oh, that's just how shit be going on. Now you go over to this fool's house, you see he laid out in the grass, he's bleeding, his toe clearly over there, way over there, and you gotta take good care of this man. Now, when you get to this man, you got all this shit going on. What do you want to do with his foot, everyone? Oh, you just throw his ass on ice, huh?
Pressure.
Oh, okay. Oh, okay. You just tourniquet. What I heard. So you created a tourniquet. Because you know it ain't gonna stop bleeding unless you tie something around it. Now, you use your halter top. Screaming. He started smiling. You took good care of that man. You have used your halter top, you've tied it around his toe. You ain't worried about your girls, you'll get covered them up later. Right now you gotta save a life. So you tied your halter around his toe, you elevated his foot. Good feelings about this because he stopped. Now you did call 911. He's smiling and happy. Now you're going to look for his toe because you know that if you can save his toe, you can encourage this man to continue walking. Now, you're looking for the toe. I thought I seen that damn. Where the fuck is that toe? You found the toe, y'all. What do you do with the toe so that they can put it back on? Put it on ice? Is that true?
No.
Hell no. You know why it ain't true? Because if you put it on ice, you frostbit it. Frostbite it, I can't use it. That's what the ERs are complaining about. Because you keep putting toes on ice. What you need to do is you need to take this toe, put it in a baggie of water or milk, but cold water is better. Maybe you were a really good nurse and you stole some normal saline from the job. Hope not. But if you did, you could have put it on that too. But normally you ain't got all that shit. You got water. So put the toe in the bag with the water, put the bag in another bag, and put both those bags in a thermos with ice. But if you take that toe and put it on ice, you just frostbit the toe. I can't use it now. That is what ERs are complaining about. Don't let the ice touch the toe, y'all. Don't do it. Now, when he gets to the ER, he's going to get a tetanus shot. You'll get your Holter top back. Everything will be fine. But remember, he needs a tetanus shot. What's he at risk for? Osteomyelitis.